All right, good evening, everybody. I'd like to call to order the December 11th Program and Budget Committee meeting. We'll start by reading our mission statement. Macomb County Community Mental Health, guided by the values, strengths, and informed choices of the people we serve, provides quality services which promote recovery, community participation, self-sufficiency, and independence. With that, I will take a motion to adopt the agenda. Motion from Chris, support from Ryan. All in favor signify by saying aye. Aye. All opposed? The agenda is adopted. Next, we'll move on to hearing of the public. Anybody from the public wishing to speak, you have 5 minutes. We are recording the meeting, so you will be famous. Going once, going twice. We will close public participation or hearing of the public. Next is item 5A, a request to approve. Request CMH Board approval to extend the Authority Task Force Committee for an additional 6 months to get financial status and funding projection. I'll take a motion. Motion from Linda, support from Megan. If any board members have any questions or comments tonight, please raise your hand. Our system is funky, so I will call on you when you raise it. Tony, go ahead.
I don't know who the members of this committee are. Can you tell us who they are? You want to go?
There's representation from this board, and that's Kathy and Linda, of the Board of Commissioners, so Phil in his double role, along with Crystal from the Board of Commissioners. From the Office of the County Executive, we have Steve Schmiegel, who's their Chief Financial Officer. And then we have 2 providers, 2 family members, and 2 primary stakeholders. And, oh yes, members of our bargaining unit. We have our union president and steward. Both are present.
Full house.
Yes.
Yes.
Thank you.
Thanks, Tony. Any other questions or comments on this item? All right. Seeing none, all in favor signify by saying aye. Aye. All opposed? Motion passes. Next is item 5B, request to approve crawl, walk, jump, run to assign its behavioral health treatment applied behavior analysis contract, PID 192186, to Acorn Health of Michigan, DBA Autism Centers of Michigan. I'll take a motion to approve.
Motion to approve.
Motion from Lori. Support from Tony. Anybody want to speak to this at all? Linda?
I just have a question. I've been
Sure.
to the crawl, walk, jump site. So what is this reconfiguration? What is that change?
Through the chair, this was a, oh, hi. Did, Laura's here if you need more details, but it was a purchase. They were purchased by the other entity, and in order to make our contracts match, we had to update it.
So it's the same service, same site, same.
New owner,
Okay,
yep.
new owner. Thank you. Who we like the new owner? I mean, they can just get they can't just get a contract. They must have had to meet the requirements and be.
They're not providing those services. They purchased like the business entity. So we did, they've been a good provider. They've been providing those services. They were purchased. There's a lot of merging and acquisitions going on with the ABA providers, and this was just part and parcel of that. I don't know if we have any additional information on the new owner.
I have a few points that the
Can you come up to the microphone? Thank you.
the president emailed me a bunch of points that I can share with you. He wanted to attend. He's in Traverse City. He said he was going to try to attend the full board. If you have further questions, it might be too late by then, right? But I can always reach out to him if you have more questions between then and now. The agency is it's certified as a behavioral health center of excellence from the BHCOE. And that is a pretty difficult certification to receive, which is, it's a new one for ABA, so that's a good thing. They're going to hire all the staff that are currently there. It'll be the same people being served, the same staff being served, just new owners, basically. Yep.
Any other questions or comments? All right, seeing none, all in favor signify by saying aye. Aye. All opposed? Motion passes. Next is item 5C, request to approve contract with Independent Community Care Services for the provision of community living supports and respite services effective December 1st, 2019 through September 30th, 2021. Take a motion to approve.
Move to approve.
Motion from Linda, support from Kathy.
This is a provider that Adam and I have worked with previously, and she's already helped us with a single, 3 cases so far. So I'll pass over the details to Adam, and we'll go from there.
So one thing that they do very well is help us with high needs and difficult to place cases. We've had a few cases that were dropped off at the emergency room, and because of my relationship with them, I have a solid working relationship, we were able to reach out and see if they would be able to work with the individuals. They rarely turn a person down. I've never seen them drop someone off at the emergency room when they're frustrated with them, so they're a great resource to have. And like we mentioned, we've got 3 single case agreements with them right now, and would like to just continue to use them as a resource.
Thank you. Any questions or comments for Adam or Dave on this one? All right, seeing none, all in favor signify by saying aye. Aye. All opposed? Motion passes. Next is item 5D, request to approve a request for proposal for a new learning management system to utilize online training modules.
So moved.
Motion from Megan. Support from Chris. Adam, you want to talk about this one?
Yeah, so currently our online learning system is Relias. We're working with Relias to reduce our number of seats because they're expensive. And we do still have some needs for online training with our network. So we're going to be looking for a much more cost-effective online training system. We're also looking to do more of our trainings online, ones that we used to do face-to-face. So that we already have a bunch of them filmed, correct, Cindy?
Yes.
So we already have a lot of them filmed, we just need a place to put them and a way to get people there. So this RFP will cover that system.
Thank you. Any questions or comments? Kathy?
Thank you for continuing looking for ways to save money, whatever. There are times, though, when it's advantageous to just be in a room with peers and be able to discuss things. Are there still opportunities for that type of training?
Yes.
Okay, thank you.
Any other questions or comments? All right, seeing none, all in favor signify by saying aye. Aye. All opposed? Motion passes. Next is item 5E, approval of commercial lease for Community Care Center. Take a motion to approve. Motion from Tony. Support from Brian. Any questions? You want TJ to come up and discuss? Or Tracy? Or both?
Oh, let's go with both.
Dave said both, to be fair, so it's his fault.
You're here. Would you like an overview at all?
Quick
Just
overview,
to get the questions?
sure.
Sure.
Thank you.
The CCC, or the Community Care Center, is located at the 15-mile in Van Dyke, just to refresh your memory. If you notice, it's listed, it's just under 50,000 square feet. It holds up to about 184 of our staff, and it has the programs listed there, such as BDPS and so on. We negotiated this lease with the current landlord. It is our cheapest lease, so although you are seeing a slight increase in this lease, it's still only $5 a square foot, or a little bit above $5 a square foot. So to give you a comparable, we have leases that are up to just under $14 a square foot. So although it's an increase, it's still extremely reasonable for the pricing that we have been offered.
And it does have the mandated out clause by Corp Counsel.
If you notice in the write-up, I did put that, we've made it very specific that it's at our sole discretion, so if there is some extreme situation for loss of funding or whatever reason, we do have an out. It also has a global out that you'll, once you read through the lease, that says in 2022, I believe it is, we could get out without sole discretion, just literally on a certain date, walk away for no reason, and not even advise.
And it is where the holiday party is tomorrow, where you're all coming.
So look at it in a different perspective tomorrow, yes.
That's really why I called you guys up. Is there any questions or comments on this one? All right, seeing none, we have a motion and support. All in favor signify by saying aye. Aye. All opposed? Motion passes. Next is item 5F, approval of residential lease A. Take a motion to approve. Motion from Lori, support from Linda. Does anybody have questions on this one? Or TJ, do you want to speak to it at all?
You will see a slight increase on this residential property. This is one of the very first that we've had in almost the last 10 years as an increase. Very surprising that we haven't seen more increases up to this point. At the last go-around, this was a reduction of 23%. So we're now getting back into the market after the downturn, which we took advantage of from 2008. So this one laid out before you has a slight increase. We still think it's a great value, and it's sort of in preparation of the leases that are to come. We may start to see some increases. We're still fighting diligently to hold the line on those as much as we possibly can. But
Still is one of the least expensive homes, even with the increases, while still being one of the higher quality homes, physical structure-wise.
Thank you. Any questions or comments? All right, seeing none, all in favor signify by saying aye. Aye. All opposed? Motion passes. Thank you. Next is item 5G, request to approve candidates for appointment to the Citizens Advisory Council.
Lori Valueway is here, and she has some additional information on those candidates.
Motion from Linda, support from Brian. Come on up.
Threw it all up.
I know, I tested everybody, making sure you're all awake. We're cruising through.
You all, I hope you all received the description of the candidates. Okay, so you know these are three very motivated ladies. One of them is a former employee of CMH, a couple years retired, who doesn't want to waste everything that she learned. And then we have two others who are parents of adults with developmental disabilities, and they're very, very motivated to be involved in the system, and they've already attended 2 or 3 meetings just as guests, so they're anxiously awaiting your approval.
Great, thank you. Linda?
I just want to thank Lori for all that she does. She's the liaison to the CAC, and she keeps our memos straight. And but she did a great job in interviewing and selecting these new candidates. And as she said, they've been to a couple of meetings, not participating, but seeing if they want to join us too. And I highly support these 3 names. Cindy, I think, is the person on our. Is Cindy?
Yes.
She's on the task force
Yes, she
authority
is.
as a parent on the authority task force. And so, of course, and I'm very proud that now I think most people on this board know what CAC stands for. We don't have to pay a quarter when we use CAC. So that's good, because they're the folks who give us the input that we need. And the directors go, and Dave has not missed a meeting since we finally got his calendar straightened out there that first couple months. But and he gives such a great presentation to them that I wish all of you could be there, because I learned more than what I learned here. So
Of course, board members are always welcome.
yes. And so we're encouraging them to give us feedback, and they also want to come. I guess maybe I could ask here what your pleasure is. They want to come and give a report either quarterly or every 6 months, and they're actually preparing one now. So after the first of the year, when the new members are on, they'll do that.
Perfect. Thank you, Linda. Any other questions or, Tony?
Are there any of the members here tonight?
No, none of the, no.
Thank you.
Yep.
Any other questions or comments? Or,
Tony used to be on, so Tony can
Totally
speak.
right.
Correct.
There's a couple board members there used to be.
Can I speak?
absolutely. You want to turn your microphone on?
Sure. I got quite a bit of the education into this whole system right at that CAC. And not that I know everything, I probably never will, but I'm dangerous right now. And I think, I don't know why, but I feel like Lori was one of my angels.
Oh, how sweet.
Anyway, thank you very much.
Thank you
Also,
for that.
I would love to see more of the CAC members at these board meetings so they can,
You know, I believe that our CAC chair was planning to come tonight, because he did talk to me about it, but I would just, you know, they're all family members of people with needs. So even if you plan for something,
anyway, thank you very much, Lori.
thank you.
Nick?
Yeah, I just want to second Linda's suggestion that if we could get, I mean, they're supposed to be advising, obviously they advise the staff and so forth, but it would be helpful to get their advice. That's why
Okay.
they're an advisory committee, so we would like to hear from them. If they can't be here in person, even in writing, but we would love to have the chair here. Maybe
Okay.
we could even put that on the agenda for a full board meeting periodically. So I think Linda's absolutely right.
Thank you, Nick. Linda?
And when we're, a number of them are bringing their family members to the holiday gathering tomorrow, or they intend to.
Yeah.
So you might meet them there.
Great, thank you. Any other questions or comments? All right, seeing none, we have a motion and support. All in favor signify by saying aye. Aye. All opposed? Motion passes. Thank you. Keep up the good work.
Thank you.
Next is item 5H, request to approve the out-of-state travel for the veteran navigator to attend the Military Social Work and Behavioral Health Conference held on April 9th and 10th, 2020 in Austin, Texas. I'll take a motion to approve. Motion from Brian, support from Dana. Any questions or comments on this one? Nick?
I thought we already did this, but that's, I mean, I don't have an objection, I'm just trying to figure out. My memory wrong?
Oh, well.
It could be.
Yeah, it was for a different location. The veteran navigator,
Didn't get to, and now we're approving it for him.
no, this is a second one.
Oh, this is another.
Yes, yep.
There's two of them going on back to back.
Any other question? Megan?
I apologize, newer board member. Is the veteran navigator a person, or is that like a group of people?
One person.
Have we met them?
She presented a couple months.
Okay, I can't remember.
Yeah, she.
Okay,
Yep.
Former Marine, I think?
okay,
Her name's Nicole.
Nicole, okay,
And she did
perfect.
present. And
Okay, thank you.
Mm-hmm. Any other questions or comments? All right, seeing none, all in favor signify by saying aye. Aye. All opposed? Motion passes. Next is item 5I, request to approve the out-of-state travel for Dave Pankatai, CEO, to attend the NatCon 20, the National Council for Behavioral Health's annual conference. The conference will be held on Sunday, April 5th through the 7th, 2020 at the Austin Convention Center in Austin, Texas. I sense a theme. Motion from Linda, support from Brian. Any questions or comments as to why they're both going to Austin? Is that different dates?
It's not in August.
All right, seeing none, all in favor signify by saying aye. Aye. All opposed? Motion passes. Your trips are granted. Next, receive and file. I don't have anything to receive and or file. Item 7, resolutions. There are 2 on your printed agenda, but there are 3 on the iPad agenda, so we're going to go with the 3. I'll take a motion to do all 3 of them. Resolutions for Randy O'Brien, Kathleen Parzinski, and Joyce Schleicher. Motion from Megan, support from Chris. Any comments? Any questions? Are any of them coming to full board? Can we harass Randy one more time? Perfect. All right. Any other questions, comments? All right. Seeing none, all in favor signify by saying aye. Aye. All opposed? Motion passes. Next, we have other agenda items. Start with Dave and then go to board members.
Good evening. I'll be the other agenda. There's lots going on. I have been emailing the board, so if anybody has any questions, I'm always happy to field those. I will be communicating to our staff as well as follow-up to Director Gordon's presentation at the state level. And then Adam and I did have a follow-up teleconference with Sarah Etsy, who's his right-hand person, and we were able to get some of our issues and concerns. I shared that summary with the board members as well. She was stressing in that conversation what I already knew, but it was much better hearing it directly from her, that it's a plan right now. It's has yet to be approved by anybody. It will need some legislative approval. It will need some changes to existing rules and standards in order for them to move forward. So right now, it's just their idea of how they would like the system to look at some future point. The 2022 implementation date is very aggressive. The PIHPs were created by the insurance code so that we are risk-bearing entities. The new model calls for SIPs to be in place, so those would have to be approved through the insurance code, and that's just one example of how complex this model change will be. So I will continue to track it. I will continue to share information. But the message from the state and from me to the staff of Macomb County Community Mental Health is that's all it is right now. It's not a for certain or a given. Everything's on the table for changes, and we will continue to share that information as it becomes available. Apparently Linda caught me on the radio the other day too.
Cindy, our wonderful or somebody with the website, whoever's doing it, send a little
blurb. So I do have to give a lot of thanks and appreciation to Matt Jenkins, who is our liaison with the Mental Health Court. He presented on WJR 760 from the jail with me yesterday. Mark Hackle was hosting a media day event. So they were on site at the prison. We were in a former holding cell, it appeared to be, with bars and cots and everything. So it was my first time in jail. My second time on the live radio, so it still takes a little getting used to. But the topic was our services that could be offered to people in lieu of incarceration. And again, Matt did a wonderful job talking about the mental health courts. I gave a plug to our Hope Not Handcuffs, who were down in the lobby here as we were coming up. And I have no idea. It seemed to go by really fast and at other times very slow. So I'm not sure exactly. I've yet to listen to it or re-listen to it. But it was an experience. And there's been numerous plugs tonight for the holiday party tomorrow. So I will give my invitation as well. It's on 12/12 at 12. and it's not on 12 Mile, it's on 15 Mile, at our CCC, which, thanks to your approval, we can continue to lease. So thank you, and any questions? Yes.
I just have one comment about the holiday party, only because I bought mine. But the staff is collecting socks or warm gloves for the homeless, and you'll get a ticket for a raffle drawing, which is why I bought mine. But it would be fun to, if you can, shop in time to support the staff in that effort. And I think it's wonderful that they're doing that at their holiday party.
Thank you.
Nick?
David, I just want to thank you for all of the information you've sent around on this. And as you know, it's an area that I've been doing a lot of work on, and I do intend to bring it before the Legislative and Policy Committee. We will wait until after Christmas, I think, lest we not have a quorum. But I would urge all of the members, if you haven't already, to read the PowerPoint presentation that Dave sent around. And also you can go online at the House Legislative site and see it's archived as one of the videos, the actual hearing before the Joint House and Senate Community Health Subcommittees, I think it was. Subcommittee, that Director Gordon gave. It's about an hour, and so you want to have some time to do it, but it's really very informative because it gives you his whole presentation of the directions and why he is proposing to look at some of the things we do. The more I look at the plan, I guess is what you would call it at this point, or because it's not really a proposal but plan for discussion, the more questions it raises than answers, number one. And number two, I would urge you and everybody else to wherever possible, urge them. The toughest part is the financial integration between behavioral and mental health. I mean, we haven't been able to do true integration between substance abuse and mental health, even though we've been doing it for 30 years on the financial side because of federal law. And if we can't get those two coordinated, I don't know how we get the finances coordinated. But I would urge the department, because I think that's going to be the hardest nut to crack and take a long, long time, to do the case management portion, they want to do both, the care management and the financial manager. And it makes a lot more sense to me that you don't hold the care management until you've worked out the financial integration, because they can bill up through the various structures, and we might actually get some very positive effects for consumers while we continue to battle through all of the details and difficulties of the financial integration piece.
Linda?
I have a copy, if you want to see it, of the PowerPoint, and it's really worth looking at. What we got at our meeting was hard to read and little whatever. So there is a link for this one that has pretty pictures. Dave's always good at sharing all the links that we get from the association. But also, I have a copy of the association's analysis. They analyze the proposal, but they also kind of tell you where they disagree and what they're going to oppose in the proposal. So it's really good to have both of them. And the association works closely with the Director Gordon and so forth, and informing them of there are issues about helping make sure that it's maintained as a public system. And they say they're going to oppose the proposal segments that harm the public system and those served by the system. So it's good to see both of those pieces. I'm probably not the person to tell you what the links are, but somebody will if you're interested in that. You can get it from David. And he probably has already sent it to us, but sometimes you don't always know what you're looking at when you get that.
Thank you. Any other board members? Ryan?
I just want, in my private business life, I had a client that had a problem with an employee with a mental health crisis. And so it gave that employee the number to our crisis center. And I don't know ultimately if the employee ever called, but I did call the crisis number just to make sure that it was working and that was the right number to call. And I did by chance listen to your ad, Dave, on the website. It was very informative, and I was just really impressed with the level of professionalism that our staff had when they answered my call and answered my questions. And so kudos to whoever answered the call from the crisis line.
Thank you, Ryan, and congratulations on being a new dad. Any other board members with any other items?
Are you on other agenda items?
Have been, yeah. Go ahead, Linda.
I just came loaded today. Not that kind of loaded, but I came from it. I just want to make people aware. I just came from an Operation RX meeting this afternoon, and there was a discussion on the new work requirements for Healthy Michigan, and passed by the legislature that take effect January 1st. And at the meeting, some providers were saying that was the first they heard. What happened was that they were going to exempt Healthy Michigan people, and so they were able to go in, 100,000 people who are on the mental health side, and exempt them from the work requirements, because there are exemptions for not being able to work for reasons. But they were able to just go in and push a button and exempt those. When they went to push the button on our SUD clients, they were told that because of confidentiality, which I don't know why that doesn't apply to the other side, but because of confidentiality, they weren't able to exclude them. So we have, I think, 45,000 SUD clients who would be exempt, but they didn't get exempted. So starting January 1st, and I was just at a meeting where it didn't appear that many people knew about it, they will lose their they may lose their coverage. I think it won't happen probably till March by the time it works out. But they would lose their coverage. The providers won't get paid. So it's an impact on our system. People can meet the requirement by monthly saying that they're making efforts to work and so forth. But the SUD clients could be totally exempted, and they have to go through a process, and the communication hasn't been good to get them along that path. And they also have to do it through their DHS worker, which is, another issue for some people. And they are people who, in a trauma-informed system, we know they don't just, like people say, well, this is what you have to do, and they don't necessarily are able or up to doing it at the time. So it could be a problem. And it's a problem for the PIHP because of because of how our system gets paid. Our rate is based on so many people being in the pool, and if all these people fall out of the pool, we lose money. So it will have an impact on our budget too. I of course think have a lot of personal opinions on the work rules for people who in that category for Healthy Michigan, and have worked employment programs before, and I think the $40 million could have been better used for an employment program to help people get jobs rather than just to figure out how the system to cut people off. But it's something that our providers in the community and interactions you may have need to be aware of, because it's effective January 1st. So.
Kathy?
Thank you for that report, Linda. Just to follow up, the numbers you're mentioning, like 40,000, is that statewide or just Macomb County?
Yeah. No,
statewide?
He didn't get the meeting I was at. It was Executive Board. Jeff Weifrich, he gave the report. So he was giving statewide figures, yes. Total in Michigan, 650 people are on Healthy Michigan. 650,000, right. Zeros. Right. And that's what our rate is based on.
Anyone else with anything else? All right, seeing none, we'll Lori.
Well, there's a big birthday month coming up.
So, on behalf of all of us, let's start your birthday month off. Birthday month? Your 60th birthday. Big month. Thank you. So we want to start it off well for you. What day is it? The day after Christmas. Oh, that's December the 26th.
Speech, no, I'm just kidding. All right, anyone else before we close other agenda items? All right, seeing none, we'll go to hearing of the public. Anybody from the public wishing to speak? Come on up. You have 5 minutes. Give us your name and address. We can't respond, but we will listen.
Okay. My name is Ed Ferreira, 55410 Parkview Drive, Shelby Township, Michigan. This is my first time at this forum. I've been before the full board regarding my brother last year, which is a separate issue. So just trying to educate myself tonight. And so some of my questions my question may sound out of line, since you may already be aware of it, and I understand you may not be able to answer. Just 3 comments on the agenda. One, when David Pancatai talked about Robert Gordon, I read that article, and as a brother and a guardian of someone who's been in the system for 50-some years, I still don't see a culture out there, an ombudsman culture, to assist parents, those who try to help the clients. Each unit, whether it's DHS, whether it's Macomb County Community Mental Health, whether it's an outfit like MORC, whether it's Social Security, everybody's got their own forms, their own rules. They clash constantly, and it's a disaster for somebody trying to get into the system or somebody who's already in that. Somewhere in the mental health system, I'd like to see something that says there's an ombudsman culture where somebody can grab hold of you and help you through a whole bunch of difficult things. I heard somebody from the state say there's an effort to try to make the square peg go in the round hole, and that was their job now under the new administration. 95% of what we deal with is the square peg in the round hole. That's one item. If they don't do it at the state level, I'd like to see it at Macomb County level. Number 2, I just looked at 5A, and I have no idea what an authority task force committee is that's going to deliver something that's a financial status and funding projection. Funding status and financial projections should be an ongoing activity. So I'm guessing there's a different mission there, or you're looking for another result, an end result in there. When you take that amount of time, in the outside world, usually you're benchmarking, and benchmarking data doesn't exist, and then you're going to do something with it. So I'd be curious what the mission is, what you're asking the committee to come up with, why it's taking so long, and what you're going to do with the data. And the last thing was, I'm putting on my old hat from many years ago before I retired, but at one time part of my responsibilities was the training and a lot of cultural training for over 9,500 people. And the learning management system, I don't know who uses it, what the level of the users are, but one of the things when I heard video in the RFP, a lot of companies like to use their own employees, and it turns into a disaster because the next thing you know, the employee that made the video is stole from the company or had a sexual harassment claim, and we're repeating that video constantly. So somewhere in the RFP you might want to look at that. If it's there, you may want to use other people and role play it from the outside. Just a final thought. But I'm curious about that number 2. If you're able to speak to it, I'd appreciate it. Or that item number 2 that I mentioned, which was the Authority Task Force Committee. Thank you. And a Merry Christmas to everybody. Happy birthday. Oh, you think you're awake now. You're going to be awake for the next 30 years.
Harder.
Thank you. And somebody will get back to you with answers to your questions, okay?
Good evening. I just wanted to introduce myself. I know that Dave had spoken a few weeks ago about the new chief clinical position. I'm Agnes Ward. I am the new chief clinical officer with Macomb County. I just wanted to give you a brief background. I have been in the county for 13 years. I started off as a case manager at First Resources North. And during my time here with Community Mental Health, I've held a number of different positions with a number of our clinics, supervisory positions, therapy positions, administrative positions, worked at the Access Center as a program supervisor. So I am very well aware of our system, our consumers, the needs of our consumers, and I am just so excited and honored to take on this new role with our consumers, and I'm working on a lot of projects. I have a lot of ideas on how we can improve our system of care. I'm working with the integrated care activities and improving that system, as well as our clinical services, bringing on new evidence-based practices, improving the quality of care that we provide, the current practices that we have. I have a really great passion for the work that I do. I love my job, and I love coming to my job every day. I don't think a lot of people can say that, but I really do. I came here with the flu, and Cindy Kono, my former boss, saw me and she sent me home. I didn't know I had the flu until I went to the ER, to get checked out. But I do. I love what I do, and I'm just so excited and grateful for this opportunity. And I look forward to updating you on different initiatives, working with you, and seeing you tomorrow at the holiday party. Happy holidays. Thank you.
Thank you. Anyone else from the public? Going once, going twice. We will close the hearing of the public, and with that, we will adjourn, and we will start the Personnel Committee as soon as Chris and I can switch seats.